The role of healthcare professionals in shaping the future of e-health. Overview. Healthcare professionals are at the forefront of shaping the future of e-health. This lecture explores how providers can drive innovation, ensure ethical practices, and guide the integration of new digital technologies in healthcare systems to enhance patient-centered care. Key topics: leading the adoption of e-health technologies. Healthcare professionals play a crucial role in embracing and advocating for digital health solutions within their organizations. Championing e-health. Providers can act as ambassadors for e-health tools, ensuring their benefits are communicated to patients and colleagues, and leading efforts to implement them in clinical settings. Patient education and empowerment. Educating patients on the benefits and use of digital health tools, such as patient portals, telemedicine, and wearable devices, empowers them to take a more active role in their care. Helping patients understand the security and privacy measures in place can alleviate concerns and increase adoption. Ethical considerations and patient advocacy. Healthcare professionals must ensure that new technologies do not compromise patient autonomy, privacy, or the doctor-patient relationship. Advocating for patients' rights in digital health, such as informed consent, access to data, and equity in access to e-health solutions. Collaboration across disciplines. Collaboration between healthcare providers, IT professionals, data analysts, and policymakers is essential to creating effective, patient-centered digital health solutions. Feedback loops. Healthcare professionals can provide valuable feedback on the design and usability of digital health tools, ensuring they meet the needs of both patients and providers. Training and continuous learning. Healthcare providers must stay informed about the latest digital health trends, technologies, and ethical standards to ensure they remain capable of providing high-quality care in an increasingly digital environment. Ongoing professional development. Participation in training programs that focus on digital health, data security, and patient engagement is critical for staying ahead in the evolving healthcare landscape. Real-world case studies. Successful implementation of patient-centric e-health models. Overview. This lecture highlights real-world examples of healthcare organizations that have successfully implemented patient-centric e-health models, demonstrating how digital health technologies can improve patient care, engagement, and outcomes. By exploring these case studies, learners can gain insights into best practices and strategies for effective implementation. Key topics. Case study. 1. Kaiser Permanente's integrated e-health system. Overview. Kaiser Permanente, a major U.S. healthcare organization, has developed an integrated system where electronic health records (EHRs), telemedicine, and patient portals work together to deliver seamless care. Implementation. The integration of EHRs has allowed for real-time data sharing between doctors, nurses, and other healthcare providers, improving coordination. Their patient portal MyChart enables patients to access their medical information, schedule appointments, and communicate with providers. Outcomes. The system has led to improved patient satisfaction, reduced hospital readmissions, and better management of chronic conditions due to continuous monitoring and proactive interventions. Case Study 2. NHS's digital health transformation in the UK. Overview. The UK's National Health Service, NHS, launched a large-scale digital transformation initiative aimed at improving patient access and streamlining healthcare delivery. Implementation. Key elements included the introduction of the NHS app, which enables patients to access their health records, book appointments, order prescriptions, and receive health advice. The NHS also introduced telemedicine services to enhance accessibility for rural or elderly patients. Outcomes. There was a significant reduction in appointment wait times, an increase in patient self-management, and improved access to care for underserved populations. Case Study 3. Telemedicine in Rural India. eSanjeevani. Overview. The Indian government's telemedicine program, Sanjeevani, aims to provide healthcare services to remote and underserved areas across the country. Implementation: Sanjeevani connects rural healthcare facilities with specialists in urban centers, allowing for consultations via video calls, diagnostics, and treatment plans. This system is supported by EHRs and a national telemedicine platform. Outcomes: the program has helped bridge the urban-rural healthcare gap, providing access to specialist care for millions, significantly improving patient outcomes in underserved areas. Case Study 4. Using wearables for chronic disease management, Fitbit and diabetes. Overview: healthcare organizations are increasingly adopting wearable devices like Fitbit to monitor chronic conditions such as diabetes, heart disease, and obesity. Implementation: patients with diabetes, for example, wear devices that track their physical activity, heart rate, and glucose levels. The data is shared with healthcare providers through integrated platforms, allowing for continuous monitoring and adjustment of care plans. Outcomes: increased patient engagement and self-management have led to improved disease outcomes, including better blood glucose control and reduced hospitalizations. Lessons learned: integration of systems. Successful e-health models require the seamless integration of multiple technologies, EHRs, telemedicine, wearables, and patient portals, into a cohesive system. Patient engagement: patient-centric e-health models succeed when patients are actively involved in their care through easy-to-use platforms that provide transparency and communication. Scalability and adaptability: e-health systems must be scalable to handle increasing patient loads and adaptable to various healthcare environments, including rural, underserved, and urban areas. Continuous feedback and improvement: organizations should prioritize collecting patient and provider feedback to refine systems and improve usability. Overcoming challenges in adopting e-health technologies in patient-centric care. Overview: while e-health technologies offer numerous benefits, their adoption in patient-centric care often faces significant challenges. This lecture addresses these obstacles and provides practical solutions for overcoming them to ensure successful implementation. Key topics. Challenge 1. Resistance to change among healthcare providers. Cause: healthcare professionals may be resistant to adopting new technologies due to concerns about the learning curve, increased workload, or perceived threat to traditional practices. Solution: provide comprehensive training, create a culture of innovation, and demonstrate how digital tools can enhance rather than replace their clinical expertise. Leadership should actively engage healthcare providers in the change process. Example: some hospitals have created champion roles where early adopters of technology help educate and support peers during the transition. Challenge 2. Integration with legacy systems. Cause: many healthcare organizations still rely on legacy systems that are not easily compatible with newer e-health technologies, creating barriers to integration and interoperability. Solution: invest in technologies that prioritize interoperability and work with vendors that provide flexible and scalable systems. Implementing APIs, application programming interfaces, to bridge the gap between old and new systems can facilitate smoother integration. Example: some healthcare organizations have adopted cloud-based solutions that integrate easily with both old and new systems, ensuring continuity of care. Challenge 3. Privacy and security concerns. Cause: digital health systems can be vulnerable to data breaches and cyber attacks, leading to concerns about patient privacy and data security. Solution: adopt stringent cybersecurity measures, including data encryption, secure patient authentication, and regular audits. Ensure compliance with regulations such as HIPAA and GDR to protect patient data. Example: the use of multi-factor authentication, MFA, and end-to-end encryption in telemedicine platforms helps mitigate security risks. Challenge 4. Digital divide and access issues. Cause: not all patients have access to the internet, smartphones, or the necessary technology to participate in digital health programs, particularly in underserved or rural areas. Solution: healthcare organizations can provide patients with low-cost or subsidized devices, improve internet infrastructure, and offer alternative access methods, such as phone consultations or community-based telemedicine centers. Example: programs that offer telehealth services via mobile vans or public facilities in rural areas help bridge the access gap. Challenge 5. Ensuring equity in care. Cause: digital health solutions may inadvertently exacerbate health disparities if certain populations are excluded or underserved. Solution: develop digital health solutions that are inclusive and adaptable to diverse patient needs, considering language, cultural barriers, and health literacy. Provide educational resources and support to help all patients navigate digital tools. Example: multilingual interfaces, easy-to-use apps, and community outreach initiatives can help ensure equitable access to digital health resources. Challenge 6. Maintaining human touch in a digital environment. Cause: there is concern that increased reliance on digital technologies may reduce the human element in patient care, negatively affecting the doctor-patient relationship. Solution: ensure that digital tools enhance, rather than replace, human interactions. Telemedicine, for instance, can allow for consultations that preserve face-to-face interaction, even if virtual. Example: many telemedicine platforms now offer video consultations with clinicians to maintain the personal connection, even when patients cannot be physically present.